Good afternoon, everyone, and thank you for the opportunity to present today. As Nathan kindly mentioned, I'll be talking about the power of parents, which is aimed at developing evidence informed communication strategies to reduce parental supply of alcohol to adolescents. I would like to begin by acknowledging and thanking all the chief investigators, associate investigators, consumer advisory panel, as well as the participants from Study One who have extended their support to the project thus far. The project is funded by the Medical Research Future Fund. So thank you to everyone who's contributed. A little bit about the project. So, this project sits at the intersection of alcohol prevention, behavioral science, as well as health communication research. Broadly, the program examines how parents engage with alcohol prevention communication and that how it may shape their intentions of alcohol supply during teenage years. Oops. The program does consist of 4 linked studies that build progressively across the project. Study 1 involved co-design workshops with parent-adolescent dyads, and they were conducted the research to look at the communication concept and message approaches. The second study, which I'll talk a little bit about today, is a national message testing and behavioral modeling study examining the variability in parent responses to prevention communication. Study 3 will be a repeat exposure randomized control trial looking at the repeated campaign exposure over time. And the fourth study involves an economic analysis examining potential return on investment as well as the scalability of campaign implementation. Together, these studies move from exploratory to developmental work through to population testing, as well as implementation considerations as well. So, a little bit of background to understand where the program of research is situated. Alcohol is a leading contributor to harm amongst adolescents, and Australian guidelines recommend that any individuals under the age of 18 should not be consuming alcohol. Despite this, parental supply remains relatively common within Australia, with many parents supplying alcohol, believing that it is protective and teaches safe and responsible drinking at home. However, there's a large body of evidence that links parental supply with earlier initiation, heavier drinking patterns, as well as increased alcohol related harms. We also know that drinking alcohol during teenage years can harm brain development and increase risk of injury and accidents in the future. Taken together, this highlights an important disconnect between the evidence-based guidance that is present and the parent perceptions regarding lower risk alcohol consumption during teenage years. Importantly, this data from the Australian Secondary Students Alcohol and Drugs Survey show that parents do remain a large source of alcohol for teenagers. From a prevention perspective, this highlights that parents are a critical intervention point that we can target, which is what this body of research is trying to do as well. To begin with, we started with co-design workshops with parent-adolescent dyads across metropolitan as well as regional Australian settings. Parents and adolescents participated in separate facilitated groups, exploring reactions to different communication messaging. The images primarily show the workshop process as well as examples of the materials that participants engaged with. So, several findings emerged consistently across the co-design workshop. Participants responded strongly to risk-based messaging, particularly around brain development, future health, and decision-making harms associated with adolescent alcohol use. Social norms also appeared to be highly influential. Many parents were interested in understanding what other parents are doing, as well as being able to take relief from the fact that most parents are not supplying. Emotional tone was the last one that substantially shaped engagement with messaging. Concepts that were framed around concern, protectiveness, or parental responsibility were received more positively compared to messages that were perceived as judgmental or blaming. So, all of these findings were then used to inform the design of study two. As we continue to see that there's a lot of variability in which parents are responding to which messages, and we wanted to understand the profiles of those parents. Alcohol prevention communication research does often focus on average message effects at the population level. However, we do know from research and through study one that there are multiple factors that affect that supply behavior, which are listed on the left. And as a result, we were interested rather than finding just one best concept that examines whether receptivity varies. We wanted to know whether message receptivity varies according to parent characteristics, beliefs, norms, and prior supply behavior. The broader goal is to understand which communication approaches resonate across different parent profiles and the behavioral mechanisms that underpin those decisions as well. So, the conceptual framework that reflects the theoretical structure underpinning this study is informed by behavioral science approaches, including constructs aligned with the theory of planned behavior. The framework proposes that parent level factors, including beliefs, norms, perceived control, shape how parents engage with prevention messages. Then these messages are then measured through perceived message effectiveness, emotional responses, as well as engagement or disengagement that we notice. We then think that that message receptivity influences behavioral outcomes, such as supply intentions and the likelihood of supply, which was also something we are intending to measure through our survey. Overall, we would try to analyze everything with repeated measures, mixed effects regression model to examine the variability in the responses across parent groups. A key contribution of this work is its focus on the variability of the parents' responses that we are noticing to alcohol prevention communication. Rather than assuming that prevention messages operate uniformly across populations, the study highlights the potential value of more targeted and theoretically informed communication approaches. We're, of course, going to continue with data collection and analysis for study two, and then continuing on with study 3 and 4 as well. Ultimately, we hope that the findings contribute to a more effective public health prevention strategy aimed at reducing adolescent alcohol-related harm. Thank you.